Artifacts are things on the ultrasound screen that are not real and usually result from a misinterpretation of data by the ultrasound machine. A few artifacts will be discussed here. Other artifacts will be discussed in later DVDs. An acoustic shadow occurs when the ultrasound beam is completely reflected or completely absorbed by a tissue. The colon is a good example. Normal fecal material contains a lot of gas and is highly reflective. So the surface of the colon closest to the transducer is hyperechoic, but the ultrasound machine receives no return from deeper parts of the colon. Because there is no ultrasound return, the ultrasound machine assumes there is nothing there and shows a large anechoic or acoustic shadow. The shadow hides deeper structures. A rim shadow, or edge shadow, occurs when the ultrasound beam is refracted rather than reflected by the curved edge of a structure. The kidney is a good example. Using a convex transducer with the kidney centered on the ultrasound screen, the ultrasound beam at the center of the kidney is reflected straight back to the transducer. However, the beam is moving at an angle when it strikes the curved edges of both poles of the kidney. This part of the beam is refracted away and does not return to the transducer. The ultrasound machine assumes there is nothing there, and shadows appear at both ends of the kidney. These shadows can hide deeper structures, like the adrenal glands. Use of a linear transducer greatly reduces or eliminates rim or edge shadows. Gas completely reflects the ultrasound beam, and the beam bounces back and forth between the transducer and the gas, causing a reverberation or comet tail artifact. As the ultrasound beam bounces back and forth, the ultrasound machine assumes it is receiving hyperechoic signals from deeper and deeper areas. This artifact can hide deeper structures. Gas artifact is expected in the gastrointestinal system. Sometimes gas artifact may be seen in places where it should not be, like the gallbladder or urinary bladder. This would suggest a gas-producing bacteria in those organs.